Thanks very much. Hi, everybody. Welcome and thanks for joining today. Happy National Public Health Week, Day 2. We hope that the week's been fruitful for everybody. And welcome to our webinar. We're here today to learn about health communications, specifically improving health outcomes through connections of various forms, ranging from the interpersonal, really one-on-one conversations, all the way to massive scales through online influencers. This webinar was sponsored by APHA's Health Communication Matters group, and I can tell you a little bit more about that. Health Communication Matters is a collaborative committee of members from two groups within APHA. One is the Health Communication Working Group, and the second is the Community Health Planning and Policy Development section. And if either of those topics or both of them sound interesting to you and you want to be part of planning this webinar in the future, there's some contact information at the lower right hand of this slide, and you can learn more about our efforts there. Thank you also to the rest of my Health Communications Matters planning team, whose names are right there on the slides. And thank you also to the many components of APHA that joined in on promoting this webinar, on co-sponsoring it, on really underscoring the importance of this topic in today's world. I think we can see through that wide range of groups that are represented how much communications really is a part of all of our lives in different capacities. And thank you also to the Weizmann Institute for supporting the back end of this webinar. This would not be possible without you. A couple of housekeeping things before we get started. We're scheduled for 75 minutes today. That'll include 60 minutes of moderated discussion with our panelists and 15 minutes for you, the audience, to engage with them. Please feel free to submit questions anytime during the presentation through the chat function, the Q&A function, and we'll try to get to as many questions as we can. Thank you also to those who submitted questions through the registration process. We do have those on our list and have plans to integrate them into the presentation as well. After the presentation, we'll be sharing some recommended resources at the end and via email for those who aren't able to attend live. This webinar is being recorded and it will be posted on APHA's YouTube channel in the days after the live event, probably within about a week or so, and we'll send that link as well in our follow-up email. And then just a couple of things about you. We learned a few things about who's on this webinar today from the registration form. We have people representing a good variety of states and regions across the United States, mostly US folks attending. Lots of different sectors represented as well. About a quarter of you all are from health departments, and that's ranging from local all the way up to federal. Another several attendees are from nonprofit and community-based organizations. And we have a good chunk from academia, many students among you, so thank you for joining and having us all learn together, and several clinicians who interface directly with patients. So really a good range of folks here today. And then finally, let me introduce today's panel. We have several public health leaders with experiences in different dimensions of health communication. So as moderator, we have Christine Ivory, who's the founder and CEO of Public Health John. She is dedicated to addressing inequities in healthcare and mitigating issues in the Black infant and maternal mortality crisis. She's passionate about the prevention of disease and disparities, as well as making real impact in communities. And in her role at Public Health John, Christine provides consulting and coaching on these topics to public health organizations. And she also increases awareness of critical health topics on her podcast, Public Health Gems. So I urge you all to check that out. On our panel, we have Jessica Malati Rivera, who's an infectious disease epidemiologist and a globally recognized science communicator who specializes in translating complex scientific concepts to impactful, judgment-free, and accessible information for a diverse audience. From 2020 to 2021, she served as science communication lead for the Atlantic's COVID tracking project and is currently a researcher at the Boston Children's Hospital Innovation and Digital Health Accelerator, as well as the Johns Hopkins University Center for Health Security. Finally, Jessica is also a science communication advisor at the de Beaumont Foundation. We also have Amanda Yarnell, who's been leading the Center for Health Communication at the Harvard T.H. Chan School of Public Health since 2022. In this role, she equips public health leaders to credibly communicate to credibly communicate health information in today's increasingly fragmented world. Her previous experiences include 2 decades of experience in science and health journalism, media product development, and audience engagement. And her most recent research includes working with messengers, including social media influencers, to communicate about health topics, including mental health. And finally, we have Aisha Williams, who is Deputy Director at the Atlanta Regional Collaborative for Health Improvement. Aisha has a wealth of experience in complex care coordination, community health worker models, and collective impact initiatives. Her work has an emphasis on the local factors that affect health outcomes, and in this capacity, she's worked with community partners and health systems to create community resource hubs that address social determinants of health. She's also dedicated to building a strong network of community health workers in the state of Georgia and will bring that experience to bear in today's webinar. And Christine, I'll turn it over to you to get things started.
Absolutely. Thank you so much, Nalani, for a wonderful, warm introduction. I want to first say thank you to American Public Health Association for sponsoring and really uplifting with this conversation. And also thank you to the Health Communication Matters team. This is such an exciting and wonderful group of individuals that we have present. So I look forward to being enlightening by their conversations today. So we're going to get started with our conversation, and happy Public Health Week to everyone and all that's on. We're going to just start and go around with one of our first questions. And that question to open us up is to tell us more about your work in this space, and how do you define trust as an influencer or innovator? We know that that trust is so important to build with our communities and those that we serve. And so I will go around and I'll start out with Jessica, and then we'll just round table this question.
Thank you, Christine. I love this question and feel like we could probably talk the entire time about trust. But as a little background about my work and how I got into this space, my training is in emerging infectious disease surveillance. I worked on a really exciting project almost 2 decades ago that was tracking early indicators of the next pandemic. And so to say that I had been trained for COVID-19 is a bit of an understatement. I'd worked my whole career for a moment like this. But in that training was also understanding exactly how to write, read, talk about emerging threats. As we know that when emerging infectious disease outbreaks happen, it is not just an epidemic or a pandemic that is now a threat, it is the information that can become almost as deadly. So it's both tracking epidemics and infodemics, and I've been doing that for quite a while, trying to use the training that I had in the natural sciences and the language that I understood from that to make it accessible to wide lay audiences, while bringing in the kind of cultural competence and nuance required to make sure that it reaches many different audiences. So I very much carry both of those titles with equal pride. You know, as much as I love being an epidemiologist and having that technical training, I think that my work is pretty meaningless without the ability to share it with others. And there is a quote that I often use as my mantra for life, that science isn't finished until it's communicated. And I very much live by that, that the work that I do is not just to reach my peers at fellow academic institutions and even within the public health network, but to make it so that it is usable information so that people can make informed choices for their lives. Which leads me to the concept of trust. I think that trust is often overlooked as a determinant of health. And if we don't think about it as something almost like a currency that we can very easily lose and have to work really hard to re-earn, then the work of communicating becomes that much more difficult. I also love the framing that I learned during the pandemic, that trust should never be assumed, and the work of trust should never be put on the audience themselves. It should instead be becoming worthy, trusted messengers. And so that trustworthiness is a priority of mine, and should be the priority of all science communicators and people in this space, so that we can do the work of becoming valuable messengers to the people that we're speaking to.
Absolutely. Thank you, Jessica, for that. I'm going to pass it right to Amanda, if you'd like to share about your work and how you define trust.
Yeah, a lot of what Jessica just said really resonates with me. As was mentioned, I was a science journalist for 2 decades before coming to Harvard-Chan to reboot its Center for Health Communication. The center's been around for nearly 40 years, built the playbook for working with Hollywood studios and TV networks to weave public health messaging into the kind of media that people are encountering every day, where they spend their time. So for example, its designated driver campaign worked with big TV shows like Cheers in the 90s to reduce traffic fatalities in the US. But I think the public health institutions who want to change views and habits in today's world are going to need, new approaches and new coalitions, including those with creators who are watched and trusted by millions. And so the Chan School, the Center for Health Communication that I lead, set out to build a new kind of playbook for 2024, one that helps creators connect with public health evidence and experts in a bid to improve the kind of health information that's available on the media that we all rely on today, including TikTok, Instagram, but even newsletters and things like that. A lot of the comments that Jessica just made about trust, I would totally underline those, but I would also add that I think often in science, we assume that we have to be the trusted messengers. And I think that the future of trust is going to have to be distributed to some degree, given just how fractured our media environment is, and how many different people we're going to need to speak to win back the kind of trust that we may once have taken for granted. So yeah, we could talk more about that today. I hope so. But yeah, really looking and thinking about how you build those coalitions that are the basis of trust, and not just working on it ourselves.
Absolutely. Thank you, Amanda. It's great to hear about that coalition, and we look forward to hearing more. And Aisha, we're going to go to you next. Can you tell us more about how you define trust and also about your work?
Thank you. So much of what Jessica and Amanda have said, I totally agree with. I have been working in community health, health education, health promotion for quite a while now. And within that time, just have really had the appreciation of community health workers, and having been able to work as a community health worker, and also build capacity and workforce development for community health workers in Georgia. I think they are uniquely positioned to address the misinformation that comes from the various social media outlets, and they are poised to be the trusted messengers of the communities that they serve. And that community could be a virtual community, they could be working remotely with a healthcare system, or they could be a place-based community health worker who is, located in the west side of Atlanta, which is where I was at. And, as you mentioned, it needs to be distributed. And community health workers are one of those people who can really serve in that role of helping to, provide the right information at the right time. And a really big part of building trust within communities is reliability. And so it's about being able to deliver on what you say that you're going to do, and be able to, provide that factual information that they can fact check, because oftentimes they will be able to go and Google and make sure that what you're telling them is accurate. And so I really do think that community health workers, particularly in COVID, we saw that the value that they have in providing trust in the community, and being able to be a catalyst for, changing the way people think about things. And so, yeah, I'm just excited to kind of be a part of that work, and to be able to advance and elevate the role of community health workers.
Thank you, Aisha. And one thing that just stuck out to what you just mentioned, you said the right information at the right time. And that is so important, especially with our timely conversation today. On that note, I'm going to go back to Jessica as we are thinking about timely information sharing. So Jessica, can you please share about your use in social media, what that looks like for the different platforms and channels that you may use? And can you tell us more about how you convey this public health information as well?
Yeah, absolutely. So for a lot of my work prior to COVID-19, my use of social media was very much kind of behind the scenes for whichever group I was working with in content creation and editing. But when COVID-19 emerged, I took my very private social media accounts public because I saw a very specific need of meeting people where they were. And it seems like social media was becoming inundated with a ton of content related to COVID-19, misinformation, disinformation, good information, difficult to understand information, and everything in between. And folks in my life who knew my background were kind of reaching out incessantly saying, wasn't this something you were talking about 15 years ago, 20 years ago when you were at Georgetown? And I said, you know what, I probably can kill a few birds with a one stone and answer frequently asked questions using Instagram. That was the medium that I had chosen. That's where I was mostly seeing the information that I wanted to either help modify or explain. And so I started to use stories, the feature of having very quick 15-second stories, and used a kind of call and response dynamic that I had created by soliciting questions to my audience and then posting questions that were answered either verbally, through graphics, through charts and data, with captions as well. While I was doing this, I was also the science communication lead at the COVID tracking project, and we were pretty well known for having a daily readout of the COVID stats, the cases, tests, hospitalizations, and deaths in the United States, as well as a weekly summary where we would deep dive into what these findings would mean for local communities, for anomalies that we would see in the reporting. And so I would take a lot of that content as well and turn it into shorter form content, 15-second videos. And I found that it was beyond well received. I sort of accidentally became an influencer on Instagram because there was an insatiable appetite for this type of content. And as my profile grew from a few hundred people to almost 450,000 at its peak, I realized that there was such a unique opportunity to do this in this format for the purpose of creating really reliable messages that people could not just read, but also share quite easily with their communities. Knowing how to do that and knowing which platform to use took some trial and error, a lot of error. I realized that I didn't want to do the same thing in multiple formats. I kind of found my lane and found my niche and stuck with it. Some folks found their platform to be TikTok. Some folks found their platform to stay on Twitter. I kind of did a little bit of both in the sense that I helped manage the Twitter for the COVID tracking project, which was a very popular Twitter account, and then kept my Instagram personal, but taking a lot of that information to my personal page for folks who became kind of really reliant on the cadence of my reporting, which was almost every day, multiple times a day.
Amazing. And thank you for your work and being able to transform your personal platform into something that's so powerful. I want to add on to that question a little bit, Jessica, and bring a little bit more out before moving on. Can you also share about how you decide which type of public health departments or community organizations that you collaborate with, and just tell us about those ways that you do?
Definitely. So I keep recalling back to my time at the COVID tracking project because that was when I had the most one-on-one interactions with public health departments. And we had relationships with all 50 state public health departments and 6 territories. And the purpose of that was because we didn't want to have any sort of bias towards red or blue states. We wanted to make this as nonpartisan and as pro-public health as possible. And in doing so, we gained the trust of all 56 jurisdictions that we worked with. Which was really, really unique. And it made it so that the relationship that we had was not antagonistic. It really was partnership. And so we chose all of them because we wanted all of them to do well. And the way in which we had something called state grades, we didn't want to grade the way the state was responding to the pandemic. We wanted to grade the quality of their data for the purpose of increasing the quality of that data. For the purpose of making it so that they had the best information, the best tools, the best ways to communicate those tools. And I will say across the board, all 56 states were very motivated to get that A at the end.
Thank you for sharing that. Really wonderful to hear about that motivation and getting everyone involved at the table. I'm going to move on to Amanda next to ask a question here. How does the weight of creators who lead digital communities balance against brands like the CDC? Can you share more on that?
Yeah, I think brands everywhere, and I wouldn't even say brands, but institutions, trust in institutions is in decline. You see it across the board in Pew surveys and the Edelman Trust Barometer every year. Trust in institutions is on the wane, and we're seeing a world now where peers are as trusted as scientists for information, which is, I think, as a scientist myself, I'm a chemist by training way back in the long, long ago. It's hard to hear, but I think it's interesting. I would say that what Jessica described as becoming a creator and some of the things that she was describing as the process there is really true, right? Creators have built these communities around them that trust them for information. And some of the reason is they're authentic to themselves, right? They're speaking in their own voice. You heard Jessica talk about how she honed that. They're transparent. They're clear in what they do know and what they don't know, how they got there. And they're really responsive. They're audience directed. They're listening to what their community wants as opposed to saying, this is what I think you should know. And then the last thing I would say is that they really focus on storytelling first, right? Like they may reach for data from time to time, but they know that they're going to capture people, that they're going to get people to listen to them, to come back if they focus on storytelling as the vehicle first. And so I think because of all these things, so many creators, and we see this in the mental health space where we've piloted our project here at the center, but I see it in other spaces too, that creators are given this trust in exchange for supporting their community's information needs.
Wonderful. And I just want to add to your question too. We have a lot of great questions that have come in. But I first like to say it is wonderful to see these influencers really combine those evidence-based resources from institutions and add those stories. So I love that you added that in. Another question that came in is, what do public health professionals need to know before starting or initiating that type of campaign around health to be that trusted messenger?
You mean working with creators?
That's correct. Yes.
Yeah. I mean, I think part of it is understanding sort of what your options are. There are lots of ways to build relationships with creators. Our research has looked at how you might simply educate them, right? Provide information. We can talk about that more at some point if you're interested in it. But there are a lot of other ways to build creator programs. You can partner with a creator to talk about a specific health topic in their content. That's very similar to way that creators work with brands in general, and it's a great way to sort of understand what the drivers are, and also the information exchange. You might want to build some kind of ambassador program where you partner with creators to deliver content on a topic over some sort of extended period of time. That's great for building expertise on a topic, and also for like preparing for a rapid response. Imagine if public health departments had creators that they had regularly worked with pre-COVID. I think some of the information distribution would have been different. And you might want to do something where we're going right now is to build, creator communities where you really help creators to support your public health topic, but also each other. And not every creator is going to want to do that, but the ones that can become, I think, really powerful advocates for public health. But I would say no matter how you choose to work with creators, you're going to want to pick ones that resonate with your values and matter to the audience that you want to reach, not that know how to connect, to help you connect with their audience, even if it's through dance or humor or whatever kind of storytelling that you may not necessarily normally do. And then the last thing I would say is that just to remember that they are bringing, really valuable new media expertise to your organization. And they're going to expect to be compensated accordingly.
Wonderful. Thank you, Amanda, for that insight. We're going to move to Aisha. Have some really great information that you shared in your introduction about community health workers. So if you could just tell us a little bit more about community health workers, about their role as a trusted messenger in communities, and also how do their lived experiences support influencing across sectors and public and private sectors, that is. Just give us more information about CHWs and their role.
Yes. So community health workers, you'll oftentimes hear that they serve, as a bridge between the community and the clinical setting, or the community and the social service system. And so they really are, play a unique role of having that bi-directional communication with either the organization as well as the community. They're able to inform the organization, the needs of the community. They can help with community needs assessments and help get information about programming and services that the organization is offering back to the community. And, also, be able to have the community share their needs as well. So they really have a unique position to be able to be trusted in the community and provide that bi-directional communication. Their lived experience is really a key piece. Is what makes a community health worker a community health worker. It makes them authentic. It makes them relatable and approachable for the community that they're serving. It doesn't often always mean that they are from that community, the geographical location, but they really do have a good sense and cultural competency and cultural humility that allows them to be effective. For myself, I'm originally from Colorado, and when I moved to Georgia, I started working in this community, and it was really up to me to, earn the trust of the community that I was serving. And, I did that by listening, to them, again, being reliable, delivering on what I said I was going to do. But it was also just about being approachable as well. And I think that that's one of the, when it comes to having a community health worker program or being a community health worker, personality is everything, empathy, compassion, and when it comes to having a successful, sustainable community health worker program, who you hire and who's doing the work is really just a key piece. It goes back to what we're talking about with being a social media influencer. Being an in-person influencer is really about being able to create those connections with the community, and that's all about the person and their personality. So yeah, and they're able to do that, again, no matter the setting, no matter the title. Just to be clear, there's I think over 90 different titles that community health workers can go by, whether that's promotores or community navigators, resource moms, all these different titles, but they're all kind of still doing the same thing of addressing the social needs of their community or providing health education, advocacy, linkage to care. They're all kind of have the same roles and responsibilities, but they may go by different titles. And again, just being able to influence and share the right information at the right time. And again, to be an asset to not only the organization that they're working with, or and they're also that asset to the community.
Wonderful. It's great to hear about how listening can certainly just impact health outcomes so much. We're going to move back to Jessica. We just mentioned social media influencers. And so, how can social media influencers reinforce trust in public health professionals and also public health guidance? Can you share any recent examples around this?
There are so many examples. And first, I just want to mention that I'm so glad Aisha brought up empathy, because that is often an afterthought when it comes to science and science communication. We can lose a bit of our humanity in the way that we speak, and it could be very matter of fact and not using the type of language, especially in a high stakes and very disorienting time like a global pandemic that is absolutely frightening for many people who may not have the same sort of tolerance for this type of biological chaos as some scientists in this space. And so it's really important to remember that the way to make those connections is to bring in the humanity of even the scientists, to admit wrong and to even say what we know and what we don't know actually is a trust building factor in the way that you can leverage social media. And also, like what Amanda was saying too, that to assume that scientists are the only holders of this information is a really short-sighted view of trusted messages and messengers. We need to make it a very collaborative, interdisciplinary process. When we talk about reaching communities that are hard to reach, it means going and using the elders or the leaders or the faith leaders of those community, business owners, et cetera, who are the stakeholders and can influence change. One really cool example that comes to mind is a partnership that Uber did with Spike Lee and a number of other key influencers to help create a system to provide access to vaccine deserts. They wanted to make sure that everybody was within a mile or 5 miles max distance to a vaccination site by providing free rides to folks who may be disadvantaged because either they have a disability or they don't have access to a vehicle or access to money to get to a vaccination site. And it was beautiful. It was community focused. It was intended to create accessibility, intended to not shame people for not being able to do that work. And employed not just folks who understood the science of why vaccination was a good way to reduce harm and to protect yourself and protect others. It made it so that everybody involved, Spike Lee included, could talk about why they were doing it themselves. And I think when you think about the folks who people look up to, the folks who people want to, the children or the young adults who look at those people as role models and people that they would like to become, aspire to become like, you have to include them in this process. Again, science is not just in a silo, and science affects everyone. And so when we think about it in this community aspect, which is the core of public health, obviously the reach is going to be much, much greater.
Love that, breaking silos to have that greater reach. Amanda, we want to hear about your research. Can you tell us more about what you learned and also about the work that you've done with creators to help spread public health information through your research?
Yeah. So we built a creator program last year. We picked mental health because we saw it as a really important public health crisis, both on and off platform, but many would say on platform, on places like TikTok. So we built that program as a randomized controlled field experiment on TikTok. We were trying to figure out whether if we connected creators with evidence and experts at Harvard, could we change their content? So we actually, with our group of students and faculty here, selected 105 creators, a group of them that we felt matched our brand, took very different approaches to mental health, but, we felt weren't intentionally spreading misinformation, things like that. We took that group, we took some of them, pulled them out as a control, never spoke to them. We asked the rest of them to apply for a slot in this program. And of those who did, we randomly put half of them in a group where they came to a month-long summit. So they got access to some of our experts to ask questions of them on a regular basis on mental health topics, and also got some training in health communication. And then the other half of that group, we actually only sent them toolkits, evidence toolkits that summarized what we had shared in that summit. And then we compared their content before and after our interventions. And we found that the creators who were exposed to those health communication toolkits that we made were more likely to share evidence-based content compared to the ones who didn't get those materials. And maybe more interestingly to me, the creators who had access to our materials actually saw their content get millions more views on TikTok than before. So those evidence toolkits are simple and scalable, and we're now working on some further research with Social Current, a firm that connects nonprofits with creators, to optimize those toolkits and make them even more useful. And we're also working to get public health evidence in the hands of even more creators, so making it even easier for creators to access those toolkits.
Wonderful. Thank you for sharing that work and just the power behind the evidence-based strategies that are shared with the influencers and the great outcomes that came from that. Aisha, we're going to go to you next. And this question is about advocacy and further on to trust building. How can we build collaborative advocacy strategies for community health workers and social media influencers, and also weave in building trust and connection to support the needs of community. Do you have any examples of this?
Yeah, I would just kind of echo what Amanda was saying. I think that social media toolkits have been a great way for us to be able to kind of share out consistent information among community health workers. The National Association for Community Health Workers, for their Awareness Week, is sent out a social media toolkit. We have done the same as well, and it really does allow there to be consistent information. We're asking people to post the same information, same content on the same day, using the same hashtags, and that really kind of helps to build credibility behind what you're posting, but also that alignment around the same kind of shared messaging. And so I think that social media toolkits are, need to be utilized more often for a lot of variety of information sharing, whether it's health education or whether it's for advocacy. I think that social media toolkits are really a great way for people to be able to utilize their personal Instagram accounts or professional Instagram accounts to engage in that shared messaging. And again, with community health workers already having, being that trusted messenger within the community, it just allows them to utilize social media as another platform to share that information. And, beyond that, I think, being able to have a consistent messaging and brand as well as they are distributing printed materials within the community, or whether they're canvassing a community, being able to have that messaging be consistent as well. Oftentimes, community health worker programs or nonprofits oftentimes underfund, the marketing and health communication department. And there really is something to be said about how we say what we say, and making sure that we're saying things in a way that relates to the community that you're serving, that the imagery aligns with the community that you're serving. And all of that tends to build trust with the community, because the community sees themselves, they're like, okay, they know who they're serving. This is not just, kind of a mass market communication where, when you're able to tailor a message to the community that you're serving, it's definitely more impactful. And it kind of continues to build trust within that community when there's a sense of this messaging was created for us and by us. And I think that that is another way that community health workers can be utilized when it comes to health communication, is to, serve as that voice for the community as messaging is being created. Oftentimes, community health workers or the community themselves are brought in after messaging has been created, and to test the messaging and to kind of figure out, does this work for the community, versus being able to have like community health workers or community members be a part of that co-design process. I think that will also help to build that trust and connection to the community, and improve the utilization of the information.
I love that co-design idea, Aisha. I mean, I think that the materials that we are providing creators in our program and our model has really been give them the evidence and let them tell the evidence in their words and their story, and not being prescriptive at all, and really expecting them to bring what they know best, which is, how people expect to get that information, whether it's through like knitting or dance or skit or whatever they know their community wants. So I love that. It's really great.
Yes, I second that as well. It's great to hear about the involvement on the ground floor. I think that intentionality is so important, particularly when we're working with community. So thank you both for sharing on that. So I have one other question before I hand it off to a great number of Q&A questions that continue to flood our box here, which is amazing. But just one other question we'll ask, and then we'll move to our Q&A. I'll start over with Jessica for this one. We know that we've been talking a lot about today, trust building, authenticity. I think everyone has mentioned that same through line in our conversation today. So authenticity can help to make public health messengers more trustworthy. So we know that. How do you bring yourself, your lived experience, your personality, your public health work, and bring it into that public health communication? So we'll go roundtable with this question, but I'll start off with Jessica, and feel free to pass it on as we go along.
Great. This is such an important question because I saw a direct correlation between when I shifted from static content in the, just text versus and graphics and data to switching the camera around and doing front-facing videos. It skyrocketed. When I used my face, my voice, my messy home with my kids, at home with me while I was trying to get work done, I believe that my trust factor just exploded because I wasn't just some scientist behind a wall who was inaccessible. I was a woman of color. I was a mom of 3 young kids trying to survive this pandemic as well. I used very personal language in my experience and expressed shared sentiments of frustration, of fear, of worry, of uncertainty. And I documented a lot of my behavior choices, including how I masked, when I masked, my vaccination journey, and my reactogenicity experience for 36 hours post-vaccination for myself, for my husband, for all 3 of my children. So in leading by example, in inviting people into my very personal life and speaking to them with my voice and answering them without any sort of fanciness behind me, but with the reality of me being a human who's in this experience with them, it absolutely changed the way I related to my audience. And I cherish that because I believe that what ended up happening was community, was relationship, where people could then, there was a joke that people would send me messages and say, we refer to you as Jessica, our epidemiologist at the dinner table. And I loved that. I loved that people felt like they could phone an epidemiologist in my, in my DMs. Now it came with a great cost too, because it wasn't all, welcomed, support, but I would do that 100 times over because what it did was make science more readily accessible, make young women who didn't know that a scientist could look like me feel inspired to get into this space and even have a career pivot. And that was kind of the way in which I made science a little bit more personal and authentic.
Amazing. Thank you, Jessica. Amanda?
Yeah, I think that's, I have not a ton more to add other than to say that I think being authentic to yourself is the key in cutting through. Today, yeah, that was perfectly said. We have a ton of questions, so.
Yeah, and I'll just I just agree that, don't be scared to use your own voice and to bring your lived experience into your work. Whether if you're living with a chronic condition and you're able to, reference that as you are kind of helping someone else, live with their, chronic condition, just being able to just share what you've gone through to help someone else, I think is just a key piece of humanity and just being able to, I don't think we go through any challenges or, any experiences for our own benefit. I think it's for the benefit of others. And so just being able to leverage whatever you've gone through to be able to help influence others to know that it's possible, for them to do the same is just a key piece of the work that we do.
Absolutely. I think that was a wonderful way to sum up our first portion, just with the transparency of the lived experiences, your boldness of all 3 of you all. It's so great to hear that from you. So I want to turn it back to our leadership here on today's call. If you want to pass over any questions, we have so many, and I want to prioritize our time as well. So feel free to pass over any questions that you like, just in a remainder of our conversation. Or I could also read a few as well.
Hi, Christine. This is Jessica with the Health Communications Working Group. Yeah, if you'd like to just go ahead and read the questions that you think would be, answerable. And I'll just add that if there are any questions we don't get to, we will try to respond by email personally to you after the webinar when we're able. So thanks.
Absolutely, absolutely. So I have a wonderful question here at the top from Malcolm. Malcolm says that what are some accessible, streamlined measures for content creators and the youth, which I think is a great audience to bring into this conversation, to accredit information in this world of mis and disinformation. So really just thinking about how you can use content creators and really leverage those who are sharing these health education messages to call out any type of misinformation. So can you all share on that? Whoever would like to chime in on this?
I can go and maybe use a couple examples that we've seen our creators use in the last year, and I bet Jessica has some from COVID. But some things that we've used, humor parody, I think is perhaps one that public health doesn't use as much, but you see a lot on social, and we've seen a lot of the mental health creators in our program use it to great degree. We've seen them doing the kinds of reaction videos that are really common on TikTok in particular and other places. And also, we've seen folks actually get ahead of this in some way. Do you know what I mean? Thinking about how to prepare people for mis and disinformation that they might see in their particular area. I'm thinking here in the mental health area, some things with like eating disorders and weight discrimination that we see a lot of folks just proactively making content around that. I will say that I think these things are getting harder currently in the current world where we see a lot of suppression, particularly on Instagram of what is, considered political content by Meta, which I think, unfortunately for public health encompasses a lot of what we're doing. So I think that these are still like really hot moving targets. And to me, that's even more reason to have creators, in your corner and in your planning and in your thought process, because they understand these platforms better than anyone.
Yeah, I would agree with that, Amanda. And I would say that it's difficult and it also requires a great deal of discernment, because I think oftentimes people realize, oh, I could get pretty popular by doing myth busting and debunking, but oftentimes they're not realizing that some of those things need to be just let alone to die, because we be accidentally breathing more oxygen and life into the things that may actually just die down on their own. I think even the discernment of knowing when and how to use humor and satire, because a lot of times the underlying hook in mis and disinformation is appealing to people's emotions. And so there's a lot of fear and shame that can be stirred up by these false claims. And you definitely don't want to pile on and making people feel dumb or like shame for not having paid attention in science class back in high school. If anything, it requires some basic tools of, evidence-based too, things like a truth sandwich, starting with the truth, identifying the false claim, but then finishing with the truth so that you always lead and finish with the truth. Pre-bunking or information inoculation, which is you kind of see something stirring and brewing in the background and you front load and say, we're going to get ahead of this and say, you may see claims of XYZ. Here's where we can lead you to trusted, reliable information. This is what to believe and what not to believe, so that people can almost have a resilience towards that mis and disinformation and be better equipped to respond in real time.
Wonderful. Thank you both for sharing. And Aisha, we have a question in the Q&A for you as well. This question comes from Tammy. It says, I'm intrigued that CHWs can help marginalized people at a clinic appointment. There could be a complex need, and sometimes a patient only gets about 10 minutes. So for a CHW to help with follow-up, like transportation, even to that appointment, can you share about any type of studies or those benefits or advantageous research around people that have been served by CHWs?
Yes, there's actually quite a few studies that speak to the benefits, particularly with health outcomes for community health workers. Community health workers can serve in that clinic setting where they attend an appointment with a patient, or they can be engaged where they are seeing the patient after their visit. That's how our community resource hubs are set up. Our community health workers are based in health systems, and they actually work with the patient after their visit. And they, will provide short-term case management following that, for patients who have diabetes or hypertension. And we, across the board continue to see improvement in patients' health outcomes by working with a community health worker to address those social drivers of health. The community health worker can address, things like transportation, employment, food insecurity, any other social services that the person needs. So there's a lot of different, again, research that shows the cost savings that community health workers can have, avoiding ER visits, improving medication adherence. So there's a lot of different ways that community health workers can improve health outcomes, and not in the clinic setting as well as in place-based settings as well.
Absolutely. Thank you for sharing that. Another question that we have, and Amanda and Aisha, I know you were both talking about toolkits a little bit earlier. Emily asks, when providing a social media toolkit to creators, was there any compensation involved for them to promote the public health evidence, or did they do it voluntarily?
Yeah, in our study, this specific study, they were not compensated. It was part of a educational, wraparound educational program. But I think that that's a rare situation. I think there's a place for creator education, but if you really want to see messaging cut through, I think compensation is going to have to be a part of your package. It is real work that they are doing for you, right? It's an investment in the communication needs and information safety of your communities.
For sure. Paying people and compensating for time. Understood. Thank you so much for that. Another question that we have, and I think anyone could really share on this from our conversation today. It says, have you seen instances of intersectionality with content creators? So creators that are sharing about addressing health issues alongside social and other disparities. So if you all could share on that.
I will say that our program actually focused on those folks and actually overpopulated with them. So I would point to people like in the mental health space, just as an example, Shane McLaurin, who is in our cohort, who is on TikTok, and they talk about both what it's like to be Black in this world and trying to find therapy. So talking both about mental health and intersectional as well as with gender. And also another creator who I really think does this well in our cohort, Kobe Campbell, who is a trauma therapist and talks really strongly about this. I will say that folks who do, they get suppressed on these platforms. And so it's I think another reason that we were successful in helping people cut through. And I think a bigger impact of even simply, does the content show up in their content that we provide, is really like networking them together and making sure that those communities continue to get that information, even if platforms are suppressing it. So that's actually work that we're trying to do in the background. And I can drop a few examples in the answer to this Q&A, like with links, if anyone's interested in seeing some of the work that they're doing. But I think they're really interesting and creative. I think in many ways, they are doing really important public health advocacy, and it's kind of underground, you might say, to mainstream public health. It's really, really important. There's a reason that people are looking for health information to these platforms, and often it's because they feel like they're being spoken to specifically in intersectional ways.
Wonderful. And I think you might have spoke a little bit to one of the questions that are also represented here in the chat, but for health influencers that are sharing information like COVID-19 on their platforms, and if they receive any type of backlash, how are ways that they can help to navigate those challenges around any negative messaging that might come back to them?
I have some thoughts, but Jessica, that you do.
I very casually referenced that it came with some negativity, but that is the understatement of the year for me. The antagonism was unprecedented at times, and got frightening on several occasions. And while I am grateful for a family and circle of friends who supported me, some of it did require more backup. And some of it came in the form of Meta's team reaching out and trying to create some additional parameters to make my DMs a safer place, so that words including death threats and racist slurs would not show up in my inbox. It also involved using third-party resources like Delete Me to make sure that my personal information would not be leaked on the internet. It involved using networks like Shots Heard Around the World, which is a network intended to protect primarily pediatricians, but they reached out to include other public health practitioners who were receiving a lot of harassment online. A number of resources, and I'm happy to like list out all of the ones that I had to employ, but it comes with the territory, unfortunately, that there is a lot of antagonism and a lot of hatred around there. I will say that for the most part, even when the FBI had to contact me, which is a story for another day, I was told that a lot of times these are keyboard warriors who are braver in their basements than they are in real life, but you don't want to test your luck either. And so there are a number of safeguards that you can use to protect yourself, to protect your mental health. Also, just taking breaks was a regular practice of mine. I had to distance myself. I very much scaled back the cadence of my weekend Q&As because I would do them 6-7 hours a weekend, and realize that that sort of continuous work and continuous harassment was a lot to bear. And so distancing yourself, creating boundaries, asking for help are all kind of some of the best practices that I had to use.
Thank you.
Yeah, if I could add to that, so I spent, prior to coming to Harvard Chan, spent 20 years in journalism, a place which particularly female journalists have been targeted for years and years for their communication of all kinds. As a manager, I was blessed. Well, I personally experienced it, and then had many employees, reporters on my team who also, would get the exact same kind of hatred that Jessica's describing. This is a playbook. It's been used elsewhere, and particularly folks who are, women, particularly those from marginalized groups, especially, get this more than anyone else. It's been done in the gaming industry, it's been done in journalism, and now it's coming for science and public health. In the journalism industry, there have been built some resources and things for folks that I think don't exist here, unfortunately. In public health, one of the things that one of the students who works at the center with me put together was a digital safety kit recently. We put one out. It actually was influenced in part by some of the creators that we were working with, who experienced and have navigated things like Jessica just described without a lot of resources, without a lot of structure, and is built to help people sort of navigate that themselves and really take some actions to protect themselves in advance. But knowing sort of in public health also that there's this expectation that you're a public servant, and that just as in journalism, you're a public servant and you have some responsibility to be contactable, to be on the internet, to be present. So how do you balance those things? And so I'll drop a link to this in the chat. I think it might be useful to any of you who are perhaps considering this and maybe even navigating that yourself. It's called the Digital Safety Kit.
Mindy, you're reading my mind. That was one thing I wanted to bring up, that all of you have dropped some really great resources as we went along. And I know that someone in our Q&A asked about resources, so you will be provided resources following this webinar. I just want to ask one more question. I'm going to pass it back over to our leads after this. But Aisha, we had a comment in our Q&A that really just asked about CHWs, and if someone is interested in that pipeline of that type of career, of different type of places where CHWs and navigators and other folks in the industry sit, how can they learn more about CHWs?
Yes, so the National Association for Community Health Workers is a great place to start. Their website is nachw.org. There's also the C3 Project, which kind of talks about the consensus around roles and responsibilities and qualities of community health workers, and that website is c3project.org. And I'm also, open and available for anyone who has questions about community health workers. I've worked with place-based models, clinic-based models, and I've also done remote health education and promotion work as well, telephonic health coaching. So happy to talk about the different ways community health workers can be utilized.
Amazing. Thank you, Aisha. I'm going to pass it back to our leads. We had some really great questions, and I think I went through most of them. We answered some of them, I know, along the way in the chat. But thank you all so much for contributing to this wonderful conversation today, and I'm going to pass it right on.
Thank you, Christine, and thank you to all of our panelists for lending your time and all of your expertise and your thoughtful answers to discussing this important work. I personally found your knowledge so interesting, very much appreciated. And I know I'm going to be thinking about this in the days to come. So really appreciate your taking the time. To our attendees, thank you for taking the time to come to this event and share your questions and be engaged and learn together. This made it really rewarding for all of us. Like I said earlier, this webinar recording will be posted to the APHA YouTube channel in the coming week. And we'll send an email once that's live with a link to the recording, as well as a list of supplementary resources, including a lot of the things that were shared live during the Q&A today. If there are any questions we did not get to, we'd be happy to share these with our panelists for responses after the fact. And so I'd ask that you email those to Jessica McCann, who I think you have her email address, but just in case, it's mccanj@mwhs1.com. We would love your feedback on today's event to help us with organizing future ones through HCM and through other programs, including the topics that you most want to hear about. We have a short survey for you that I'm not sure if we're going to be able to put it in the chat, but if not, we will send it in that follow-up webinar. It's like 5 questions, 2 minutes max. So we'd really appreciate your feedback on that. And in closing, I wish all of you a wonderful and productive National Public Health Week. Thanks for attending.